Yeah, in fact, we continue with the Symposium of Valentis. Yeah, we will speak about some antiplatelet new concepts. Dr. Vasilev, here we will present our results.
Hello to everyone. My name is Dr. Vasilev from Acibadem City Clinic Cardiovascular Center. Today I will talk about the usage of nataspin in endovascular therapy. So firstly, what is nataspin? Nataspin H is a dietary supplement that combines two primary ingredients. One is nattokinase combined with hydroxytyrosol. So nattokinase is an enzyme that is extracted from natto, and natto is a traditional Japanese food that is made from soybeans which are fermented. And the hydroxytyrosol is derived from olives, and it's a potent antioxidant, and there is a lot of benefits for our cardiovascular system. Together they promote a very good healthy blood flow and overall cardiovascular wellness. The main ingredient, nattokinase, is the main pharmacologic action of nattokinase is the degradation of fibrin, basically directly by converting the prourokinase to urokinase and then increasing the formation of the enzymes and leading to a cardiovascular health by making the degradation of fibrin and promoting anti-thrombotic effects. You can see that there are a lot of other effects as reducing high blood pressure, nephroprotective actions, antiplatelet, anticoagulant effects, as I already said, and also anti-atherosclerotic and lipid-lowering effects. So basically, pleiotropic effects. Here is the direct effect of nattokinase. So everything is leading to the path plasminogen to plasmin and the degradation of fibrin. So, you know, it has a degradation directly of API-1, degradation of urokinase, prourokinase to urokinase, and then all of this is leading to the path from plasminogen to plasmin and the fibrin degradation. As I already said, and also because degradation of fibrin, that basically means anti-thrombotic effect, but there is also anticoagulation effect, which is shown to be because the nattokinase is shown to be capable of blocking the thromboxane formation, which is resulting in an inhibition of platelet aggregation and without producing every other side effect of bleeding that can happen with aspirin and P2Y12 inhibitors like clopidogrel, Brilic, and every other. So our single-center experience for 5 years, we have 630 hospitalized patients, which we dehospitalized on nataspin. And the main reason is its antithrombotic effect. And we have initiated this therapy in patients with different atherosclerotic burden, ischemic heart disease, peripheral heart disease, aortic aneurysm and dissections also, and atrial fibrillation. Here I will show you 2 case reports. The first one is a 78-year-old male patient who came to our clinic with decompensated heart failure with severe aortic valve stenosis, ischemic heart disease, stented LAD and the circumflex artery, and permanent atrial fibrillation. And I want to say that he is coming on only one antithrombotic agent, P2Y12 inhibitor, without any anticoagulation for his atrial fibrillation. As a concomitant disease, he has a dyslipidemia, diabetes, and arterial hypertension. Basically, the echo is showing a severely calcified aortic valve. You can see the gradients of 0.7 and moderate aortic insufficiency with preserved ejection fraction and pulmonary hypertension of 55 millimeters per mercury. As I already told you, he's taking only clopidogrel. he's not taking any NOAC, and he's also anemic and has low thrombocytes from the WAP results. And as a clinical decision from the heart team, because of the high perioperative risk, advanced stage, and Euroscore and STS, which are pretty high, we decided that the best treatment for him is implanting a TAVI. And basically that's what we did. As in all of our patients going for TAVI, we used our minimalistic approach. The patient is verticalized on the 4th hour post-operatively and is dehospitalized on the 2nd post-op day. The post-operative echo is showing a TAVI with pretty good gradients, no PVL, perfect ejection fraction, and dramatically reduced in the pulmonary hypertension. So keeping in mind that this is very important, I didn't say it in the beginning, that our patient has a capillary toxicosis to NOAC, and that is why he was without NOAC in his medical treatment when he came to us. We decided to give our patient Syntrom combined with nataspin because we didn't want to give him P2Y12 inhibitor, or to be exact, to continue it, because of the low thrombocyte count. And the follow-up of the patient, he's stable, has no heart failure symptoms, no bleeding, and no ischemic complications. And the results show pretty normal thrombocytes and compensated anemic syndrome. He was still anemic, but the hemoglobin was above 100, so it was pretty good. The other case report is from 73-year-old male patient who was known to the clinic and complains of numbness and weakness in his right hand. He has also undergone implantation of a stent graft into the aorta into the iliac arteries also because of renal aneurysms 4 years prior to the current admission. He is also with ischemic heart disease, so basically a pretty normal patient for our clinic. And of course, he's also coming only on P2Y12 inhibitor. The echo shows a thrombosis of the LICA and critical stenosis of the LICA, which is corresponding exactly to his clinical symptoms. And we decided on an endovascular treatment for his carotid pathology, stent implantation, and subsequent selective thrombolysis of the thrombosis of the LICA. Because of our patient had a history of gastric bleeding and embolization procedures due to endoleak in the past, endoleak from his aneurysm, the patient was deemed at high bleeding risk, and we decided to discharge him on P2Y12 inhibitor plus nataspin. The follow-up showed no bleeding, no ischemic events, intact stents of the carotid and the coronary arteries, and no data of endoleaks. And basically, these are the two cases. This is the NATO, pretty healthy foot also. And so despite it, yes, soybeans fermented, and this is the main. Yes, and this is the main food in the so-called blue zones, where the people live the most. Yes.
So we have to eat apricot and soybeans, fermented.
And everything will be all right, yes.
On daily basis. And no stress.
No. And no smoking. And so that's it. And the main thing is that nataspin, because of the natokinase, is a very good option for patients at high bleeding risk. We can give it as a prophylactic alone, and if we want to have a direct medical treatment for stenting and all other endovascular procedures, we can give it with combination with a P2Y12 inhibitor. We have a very good, yes. And our patients, there is no ischemic events from coronary and carotid stents when we discharge them on P2Y12 inhibitor plus nataspin.
Thank you.
Thank you.
Very good.
Professor Petrovsky has a very good experience with nattokinase.
Let me just shortly share our experience with you guys. Since 2015, we are using the nattokinase as a drug for preventing stroke in atrial fibrillation. So we dare to do this. For patients that are not exactly contraindicated, but bleeders from DOAC, severe bleeders, at least twice they bleed it, and they cannot tolerate vitamin K antagonists, and they have very low TTR using the vitamin K antagonists. You know that they are used for the so-called valvular atrial fibrillation. So the valvular atrial fibrillation is contraindicated for DOACs. Okay, so we used such patients, and we have around 215 patients on our database till now. We like when they were like 120, we made the first publication. But unfortunately, only our center is doing this. We want to share our experience in order to make it popular. Because the comparison between the actions of nattokinase for prevention and vitamin K antagonist, it's showing that nattokinase is doing slightly better than the vitamin K antagonist. Yes. I mean, regarding bleedings first, and then regarding complications, the thrombotic complications. So if you guys are interested, we can give you, we don't have time now, and it is not the topic of our discussion, but if you're interested, you can contact our center and we can give you lots of details about usage of the nattokinase in atrial fibrillation. Thank you.
This is great. In fact, we have, very nice. In fact, we have also very good experience, but with not with this indication. So in our practice, we are using quite largely. We have more patients. We have probably, I don't know how many, 500 or 600. We have many. In fact, we have 600 registered, and we probably much more than are not registered into the platform. But our strategy is not so much related to atrial fibrillation, but more is related to, like you mentioned, bleeders that fulfilled the minimum criteria of double antiplatelet, after, and especially in patients with anticoagulation and antiplatelet. In this scenario, we are even more liberal, and we are stopping very early, extremely early, the second antiplatelet, and we replace it with the nattokinase. And in the majority of cases, we are replacing the aspirin, but also we are replacing the clopidogrel, because there are many publications that the clopidogrel, after a long-lasting intake, can cause thrombopenia, and thrombopenia is not a good situation. So, we have probably some data, some registry data, but we don't have any randomization and any comparison. So we are speaking, and we are preparing to make a trial, and hopefully one day we are going to make a registration of a trial, and I would like to ask you to be included, to join the trial. It will be very interesting.
With pleasure.
Yeah.
What we know is that it's active and it is safe.
Definitely.
It is very safe. Believe me.
Probably you mentioned the role of COVID-19. Did you mention? Yeah, in fact, what exposed the most nattokinase was the COVID-19 and the nattokinase role of preventing both thrombosis and thromboembolia, mainly thrombosis. So because it's inherited the fibrinolytic activity. So it's not antiplatelet. It's like a fibrinolytic, but it's a natural fibrinolytic.
The only oral fibrinolytic, the only one.
Without carrying hemorrhagic risk. Yes.
Can I mention something?
Of course.
Talking about atrial fibrillation, as Professor Petrov said, but there is something, we have patients, I'm not sure how many, but patients, or let's say apixaban with atrial fibrillation, we want to do a cardioversion, we do the echo, and it shows that they have a thrombus in the appendage of the left atrium, and then in spite of that, and then on top of this, we put the nattokinase, and after a month they come, and we have patients with this combination that after that, yes, no thrombus. Yes.
Yeah. It's true.
Thank you.
Very nice.